And the inner ear, we call it as a labyrinth. There are two types, as bony labyrinth and membranous labyrinth. They enclose a fluid called as a perilymph and an endolymph. When you see this internal ear, the vestibule is divided into two parts, a utricle and a saccule, and there is a most dependent portion of the vestibule called as a endolymphatic sac. Now what happens at this region, there is an excessive collection of fluid sometimes, which is of the endolymph, and this might cause some symptoms for the patients. Say conditions like Meniere's disease, say deafness, vertigo or tinnitus, we say this is a triad of Meniere's disease. And in such cases, what they can do is like they would drain out the excessive endolymph from the endolymphatic sac. As the endolymphaticus is the most dependent portion, fluids tend to get accumulated, and they can do a shunting procedure where this endolymphatic fluid can be shunted out towards the mastoid cavity. And we also have like other fistula. It can be a oval window fistula or a round window fistula. Because if there is a fistula, there is an artificial opening. Now the physician will have to close such fistula. Okay, so these are the common procedures that are also done in the middle ear. And there is something called as a removal of glomus tumor. A glomus body is actually a baroreceptor. This gets sensitive to the pressure changes. If there is any tumor arising from these baroreceptors called as glomus tumor, we have different codes, whether it is via this mastoid bone, whether the approach is via the external auditory canal. Accordingly, you can select the codes. If an incision is being done to the labyrinth, then we need to give as a labyrinthectomy. The physician is going to remove it, then it is a labyrinthectomy.